Hi, this is Dr. Bartley Kerr, CEO of National Rejuvenation Centers. One of the bigger trends in the last 2 years in bioidentical hormone people was the advent of the pellet, or the use of the pellet. Pellet's been around for a little while. And pellets are little, like grains of rice that they implant that have hormone in it. And the hormones come out, they spit out the hormone in a consistent rhythmic way throughout 3 or 4 months when the pellets are in. Sounded really good when they came out, and it was very exciting. My problem with the pellets, do they work? Yes, they do work, but it seems that they work for a finite amount of time because the same amounts of hormone is going out, and when it does that, the body doesn't react to the same way it would if the hormone comes out sporadically like it does in nature. Similar to the way somebody takes a pain medicine. If they take a pain medicine, sometimes after a week or two, they have to take more to get the same effect. Hormones are much like that unless they come out in waves. So the pellets don't do that. The pellets give a level dose, and another issue with the pellets at this time, they don't make a pellet for every hormone. So these pellet people have to get these pellets that are very expensive implanted in them, cut a little incision and put inside of them, and then the other hormones that aren't pellets, they still have to take. One of the biggest issues I have with the pellets, and there's some pellet doctors out there that are very good, but I see if there's too much hormone in, we got a problem. I've had women with 40 or 50 times the amount of testosterone in their body on pellets. And here's the deal, that's in you for 3-4 months. You got to wait that thing out, or you have to go to a doctor to take the pellet out. Now, I don't know about you, but I've talked to some of these doctors who take pellets. So we got one guy in Tampa that actually makes a small fortune out of this. But what he does, he equates it as taking grains of rice out of Jell-O with tweezers in the dark. That's what has to be done to get the pellets out. At first, they sounded like they were a really good deal. They're very profitable for the practitioner giving them. I have no problem if they want to do that as long as the efficacy of the product is there and the patient's getting results. Another issue I have with the pellets, if pellets were wonderful, how come only hormones are in them? How come they don't put Lipitor? How come they don't put, how about diabetic medication in a pellet? We don't see those as much because it's not a novelty. So I think the pellets will come and go, and not to bash the pellet practitioners because I know some fine ones, but hands down, there's no comparison, a pellet to an injectable testosterone, a pellet to a oral progesterone, not touching it.